Doctors yank out body part from man who had a stuffy nose for 2 years. If you're suffering from the clogged nose, we seldom think of it to be anything but an allergy or maybe the flu. Sometimes it can be caused by a sinus infection, but thinking of it as anything worse? Probably no. A man from Denmark was having problems with a blocked nose for years. When he found out the reason for his problem, he was shocked. This 59-year-old was having problems with nasal congestion and discharge for 2 years. He was also complaining of his loss of smell. The doctors checked on him, did some investigation based on his symptoms. What they found was something out of the ordinary. It's a tooth. According to BMJ case reports, the man suffered from facial trauma in his younger years. That's why after the incident, he was left with a fractured jaw and nose. They believe that this is the reason why a tooth was lodged into his sinuses and has been there for years. Dr. Milos Fugelsang said that this man most likely had intranasal retained tooth since he was young, but just experienced the late onset of his symptoms. But according to the Sky News reports, the doctors claimed that there was no evidence to support that the previous trauma caused the nasal growth. A CAT scan was requested, and the doctors also used an endoscope in order for them to successfully remove the tooth. This procedure was done at University Hospital Aarhus's ear, nose, and throat department. At first, the doctors were kind of thinking that they were removing a cyst or a tumor. Intranasal teeth are very rare, but it's also important to take into consideration since the patient experienced nasal congestion, discharge, and hyposmia. These symptoms alone can negatively affect the man's quality of life. A month after the extraction, the patient made a full recovery. He only needed nasal saline irrigation as well as 10 days worth of antibiotics. According to the reports, there were no new symptoms reported. According to Mail Online, this kind of growth is extremely rare. Only about 1% of the population can possibly be affected. When it comes to extracting objects from inside the nose, there are plenty of cases related to this that can definitely blow your mind. Just recently, a little girl named Momita Let from India needed to undergo surgery to safely remove a safety pin that was stuck from her nose. She was brought to Surrey, West Bengal, after she suffered from excruciating pain. Dr. Savendu Bhattacharya checked on her and found out that inside the nose, it wedged in open position, and for sure it was extremely painful. The doctor was able to remove the pin through her mouth, but the girl needed to be under general anesthesia. The doctor used only an endoscope and his fingers to locate the pin and remove it. He said that he saw that the pin was wedged just behind the middle turbinate of her nose, and it was too impossible to pull it out through the front because the pin was open. If they did it this way, it could have caused further injury. When it comes to our noses, we always have to take good care of them. Listen to how our body reacts. If you think that something's wrong, see your doctors as soon as possible. Don't wait for your symptoms to worsen.